approaches. And what Ayurveda was really hinting towards was more towards genetics and a more personalized approach to wellness, diet, and that's what Ayurveda really is about, the Prakriti and about basically the generalized or what you call the more personalized approach. So yes, definitely. So
So would you consider Ayurveda as the most advanced healthcare management system in ancient world?
yes, definitely, because lot of, and let me give you an example of that, is that currently there's a lot of information, lot of what do you call buzz about the gut theory,
Mm-hmm.
that everything is to the gut, and Ayurveda actually talked about the relationship between the gut, your wellness and immunity like 5,000 years ago.
So the saying goes, "You are what you eat," is true.
That's correct.
And what is a primer on Ayurveda?
So the primer in Ayurveda, and this is the book we have just written, and this is basically talks about the basics of Ayurveda, the basic concepts of Ayurveda. Some of the, for example, we've talked about different assessments, questions. We've talked about different spices and things, and this is written by healthcare professionals for healthcare professionals who either use Ayurveda into their practice or would like to use Ayurveda into their practice.
So a primer on Ayurveda recently published.
Correct.
Recently published a practical guide on personalized nutrition for dietitian, nutritionists, and healthcare professionals. So it's not only for somebody who wants to understand Ayurveda well, but this also is geared towards healthcare professionals like me
Correct.
to understand what Ayurveda is and what's the difference between modern day medical management versus Ayurvedic management.
Correct. So again, people or healthcare professionals, even dietitians, nutritionists, doctors, who actually integrate Ayurveda into practice or even are thinking of integrating Ayurveda into practice, this is a really good way to understand the basic concept of Ayurveda and understanding some of the things they can actually include in their practice.
Excellent. And our listening audience, how can they get hold of this book?
So this book is available on Amazon. Both it is in the paperback as well as the Kindle version.
Okay. So you can go on Amazon and type a primer on Ayurveda
That's correct.
by Dr. Gauri Janarkar.
Yes.
हमारा नंबर 214-817-3333 214-817-3333 आप सुन रहे हैं जान है तो जहान है. Just playing some song. We are off air.
It's a beautiful song.
Huh?
It's a beautiful song.
I play what I like.
Do they call in, the listeners?
Yeah, they call it. Every week is different. Last week we had a lot of phone calls. I think a lot depends on the topic.
Yes.
So if we just talk about autism, we won't get any phone calls because we may get few.
Yeah, exactly. It's rare.
When you talk about diet and nutrition,
Yeah.
what ghee you should eat,
Yes, definitely.
what milk you should drink, then all of a sudden everybody will call.
I remember last time one of the person had called about what I should use. I mean, what they should use for their kids
Right
when
now.
they were they had just started with the swimming and things. So what protein supplements and things. Just eat crazy.
So you ladies are doing great.
Tara Pathak, at the end we would like to have a photo and stuff.
Anything?
Yeah, please.
It's your show. Whatever you want. All right, we'll go on. You can sing along if you want to. Shayati. It's hard to stop a song. हमारा number 214-817-3333 214-817-3333 रेडियो कारवान आप सुन रहे हैं जान है तो जहान है. Going back to autism, how you diagnose autism?
Some can be diagnosed as early as 12 to 18 months.
Uh-huh.
So I think the first person who gets concerned about autism is obviously the
His
mom,
mother.
Or the father.
Mhm.
So some of the characteristics you observe, the child is not talking, or if there's regression, the first to-go physician would be the primary care pediatrician.
Mhm.
The pediatrician has a simple screener which is called as MCHAT.
Mhm.
It's a modified checklist for autism in toddlers. It's a 23-item checklist which is typically administered anywhere between 2 years and 3 years of age. And if the child fails 2 or more items on that, then the child is at risk for autism. And the next step is to get specialized evaluation through a school psychologist or through a neurologist or a
Mhm.
neurodevelopmental pediatrician who
Mhm.
can do further testing. There are also professionals called as ECI, early childhood intervention. So if you think a child has autism, the mom can call that number. It's a 1-800 number.
Mhm.
Or a neighbor or a teacher or
Mhm.
anybody can
Anybody
call
can
it.
call.
Yes.
Essentially, you can call and report a patient's name and phone numbers, parents' numbers, and
Exactly.
they'll get guidance.
They'll get guidance and they can come home and evaluate the child.
Mhm. And so there are no blood tests or imaging you guys do, or it's necessary.
So there's 2 parts of autism workup. One is the psychological workup where we do the screeners and the autism testing and the full neuropsych evaluation. And there's the medical workup, and we just spoke about genetics.
Yes.
So we do have specific genetic testing we can do in the clinic. And we at times do imaging as well, depending on what we see. And again, it comes down to a good physical exam, and once they see a neurologist or a developmental pediatrician, depending on what you see, if you think imaging is needed, we do imaging studies like MRI of the brain to look for structural abnormalities.
Now, if there's a couple with an autistic child, and child is 15 months old, what are the possibilities